Hello,
Hi.
I'm Lissette. I'm going to be your nurse today. I would like to ask you a few questions in regards to what brought you in today.
Okay.
First of all, if we can start off with your full name.
Maida Moreno.
Okay. And your date of birth.
6/29/67.
Okay. And how would you like to be addressed?
Maida's fine.
Great. What is the reason for your visit today?
I noticed this rash that I had probably like a week ago, so I thought I should just come in for it.
All right. Can I take a look?
Yeah.
All right. So I see that the rash is bright red. Do you only have it here on your forearm?
Yes.
How long have you had it?
Probably like a couple weeks.
Do you have any pain associated with the rash?
No, it just itches.
Besides itching, any other symptoms?
No.
All right. Do you have any allergies or reactions to drugs, to food,
No.
or any other thing? All right. What is your religious preference?
I'm a Muslim.
Okay. And what's your race?
I'm Hispanic and Arabic.
And your primary language?
Is English.
Do you know any other languages?
Yes. Spanish and Arabic.
All right. Are there any cultural or religious practices that you would like included in your plan of care?
No.
Maida, do you take any medications?
Yes, I take 2 inhalers, Gilera and albuterol.
Mhm.
One is twice a day, and the other one is as needed.
Got it. What would you say is your general health statement?
I think I'm pretty healthy, other than my asthma and then this new thing that just came upon me.
Okay. How long have you had asthma?
For several years now. I think I got diagnosed in '09.
Okay. And the medications that you're taking are working out?
Yes. Mm-hmm.
Any medical or psychiatric history?
No.
All right. Any surgical history?
No.
Any surgeries, injuries, or fractures?
No.
What about your immunizations?
They're up to date.
Have you had a TB test?
Yes, a month ago.
And what was the result?
It was negative.
All right. Significant family history on your father's side?
Nothing that I know of.
What about on your mother's side?
Not that I know of.
Do you have any siblings?
Nope, I'm the only child.
Okay. Do you drink alcohol, caffeine?
Tea, yes, but not alcohol.
What about tobacco or recreational drug use?
No.
Any recent lifestyle changes due to your medical condition?
Yes, I had about maybe 6 months ago, my son was diagnosed with autism, and about a month or 2 later, I got a divorce.
I'm sorry to hear that.
Thank you.
Okay. So if you could answer yes, no, or does not apply to the next few questions. Do you regularly conduct a breast self-exam?
Yes.
Have you had a mammogram?
Yes.
When was that?
A month ago.
Okay. Did everything appear okay?
Yeah.
What about a pap smear?
Same time, a month ago.
And everything was okay with that?
Yeah.
Related to safety, we have 2 questions. Do you use car seat belts?
Yes.
And do you use a helmet if you ride a bike or a motorcycle?
I don't have a bike.
Okay. Any current dietary restrictions?
I don't eat pork.
All right. Any problems related to your appetite?
I feel like my appetite has diminished with all the new things I've been dealing with lately.
Okay. What's your current weight, Maida?
110.
Is that stable for you?
It fluctuates.
All right. So have you had a recent gain or loss?
Loss.
About how many pounds?
I want to say about 5.
And what was the time frame for that?
I would say maybe like 2 months.
2 months? All right. Any problems with your teeth?
No. I had cavities, but other than that, no.
Okay. Difficulty swallowing or chewing?
No.
Any nausea or vomiting?
No.
History of GI, liver, or endocrine problems?
No.
All right, so let's talk about elimination. When was your last bowel movement?
This morning.
What was the consistency?
Solid.
And the color?
Brown.
How often do you have bowel movements?
Daily, twice a day.
Okay, so any issues with constipation then?
Mm-mm.
Any diarrhea?
No.
Blood in the stool?
No.
Okay. Do you have urgency to urinate at night?
No.
Any difficulty urinating?
Mm-mm.
Any blood in the urine?
No.
Weak or impaired strain?
No.
Any straining?
No.
Any stress incontinence?
Well, I feel stressed, but I don't have incontinence with urination, no.
Any hesitancy, frequency, or urgency to urinate?
No.
Okay. Problems sleeping or resting?
Yes. I have problems sleeping at night.
Okay. What time do you go to bed?
About 9.
9? And how long do you sleep about?
About 7, 8
7, 8 hours?
Mm-hmm.
Do you have difficulty sleeping through the night?
No.
Any sleep aids, for example, pillows, medications, or alcohol?
Pillows, yes, but not other stuff, no.
Okay. Do you exercise or have recreational activities?
No, I try to take my son for walks, but sometimes that doesn't work out very well.
Okay. Let's move on now to activities of daily living. If you can answer the following with either independent, where you do it yourself, some assistance, or you're dependent on someone else completely.
Okay.
So eating,
Independent.
dressing,
Independent.
ambulating,
Independent.
toileting,
Independent.
bathing,
Independent.
grooming,
Independent.
writing,
Independent.
all right, cooking,
Independent.
cleaning,
Independent.
shopping,
Independent.
doing laundry.
Independent, but I have my son help me sometimes.
Okay, good. Using the telephone,
Independent.
taking medication,
Independent.
managing money.
Independent.
Any issues with mobility?
No.
Do you use any assistive devices?
Nope.
Muscular weakness or fatigue?
No.
Swelling, redness, or warmth around joints or muscles?
No.
Sensation or areas of numbness?
No. No.
Okay. So do you have any cardiac or vascular problems?
No. Not
Hypertension?
that I know of. No.
Heart attacks?
No.
Varicosities?
No.
Blood clots?
No.
Do you know your cholesterol level?
No, I haven't had labs drawn in a while.
Okay. Do you have any problems related to the respiratory system? You mentioned asthma.
Yeah, other than that, no.
Okay. At rest or with activity, do you have difficulty breathing?
With activity, yes.
Any shortness of breath?
With the activity, yeah.
With activity. All right. History of pneumonia?
No.
Do you have cough?
When I feel shortness of breath, I kind of feel a cough coming. That's kind of my sign to get my inhaler.
Okay. What about, do you use oxygen?
No.
All right. Any recent or past neurologic changes? Problems with your vision?
I have glasses, but no, other than that, no.
All right. Any hearing aids or
No.
problems with your hearing? What about with taste, touch, or smell or memory? Any issues with that?
No.
All right. So the next item that we have on our assessment is called self-perception. So I would just like to ask you, you mentioned your recent divorce and your son getting diagnosed with autism. How do you perceive that event in your life?
I think it's huge. It's a big difference and a big change, but I do have a lot of people that are my go-to people, like my family and friends, to talk things out about when I'm stressed.
Okay, good. So that actually brings us to the next point. You mentioned that you have family and friends that are helping you out. That's your support system?
Yes.
Okay. Anybody else that you would like to mention?
No.
All right. And you are currently divorced, correct?
Yes.
What is your sexual identity?
I'm heterosexual.
Any history of sexually transmitted disease?
No.
And then we are almost done.
Okay.
So how are you coping with the current life events that you mentioned, divorce and your son getting diagnosed?
I mean, it's very stressful. You know, I have a hard time sleeping at night, like I said, and sometimes even eating. But I go to my friends and family for venting when I have to, when I've had a hard day.
Right.
And they're pretty good at always, helping me out around the house or if I need anything, so it's always helpful to have them.
Well, good. That's good to hear.
Thank you.
So the following items I'm going to mention to you: fear, anxiety, sorrow, loss, denial, adjustment. Do you feel any of those?
I don't feel denial, but I do feel the rest of those, yes.
Okay. And how do you cope with those?
I try to take a little bit of time for myself when I can, if my son kind of lets me. But other than that, I just have my friends and family that I lean to and on.
Okay. Any history of falls?
No.
All right. Well, Maida, that has concluded our assessment.
Okay.
Do you have any questions? Anything you would like to add?
Nope, not right now.
Great. Thank you so much.
Okay, thank you.
The doctor will be in just a few minutes.
Okay, thanks.